make you dizzy?
James, he was a really humble person, but he had the best personality.
James was very special. I knew that the first moment I met him in the clinic, and I told my nurse the first day we met him, there's something about this young gentleman. I think he's going to have a big impact in some way. I don't know how, but he seemed like very special from the beginning.
When James went to see a neurologist for something completely unrelated, but when he went to the follow-up appointment, the neurologist said, I think you should call your wife, and I think she should come meet you for this appointment. So he called me, and I had the sinking feeling that obviously something was not right, but I don't think either one of us were prepared to hear that this perfectly healthy looking man had a brain tumor growing.
That's a rooster.
Ollie was 1, Harrison was 2.5, and Parker was 4. So you can imagine just how daunting all of that seemed at first.
It is always impressive to me that James, pretty much from the beginning, was thinking about how he could help others.
He always was thinking about how he could help others, what he could do to make his situation better for our family, what he could do to make it better for others. And I know I'm not going to be here forever. And so whatever I can do to make this journey and this road for other patients and their families a little bit easier, I would love to do.
It's now been a decade of the Broach Foundation. And what's amazing about it is that Jamie has really stayed engaged. Her boys, they've taken up the cause too, honoring their dad with this legacy of the Broach Foundation.
It's been one of my greatest joys, watching the boys grow and develop and watching their involvement with the Broach Foundation. Parker this year at Straight Jesuit founded the Cancer Awareness Club, and he has been able to do so many great things, bringing awareness not only to brain cancer, but to other cancers. James would be so proud of them if he could see them now.
The impact has been huge, and it's really because of this one person who, despite the hardship he was going through, was thinking about others and really wanted to have an impact.
We know that the NIH and other foundations are willing to support brain cancer research, but at a much later stage. The government doesn't want to throw millions of dollars at a project that has really any risk of failure. But you can't get to those later stage projects without the early stage research.
Brain cancer impacts essentially everyone. It doesn't discriminate. The nervous system is a very unique organ. So when you start thinking about it, it has cells that are not found in any other part of the body. The brain has a very unique immune system. Again, it has a type of immune cell called the microglia that's not found anywhere else in the body. It's specialized to the brain. And the immune system in the brain is very unique in that it's considered a bit of a privileged site. The blood vessels have specialized structures, which we call the blood-brain barrier, that prevents things from getting into the brain. So there's no other organ in the body that has this specialized extra circulation called the cerebrospinal fluid. So all of those come together to make a very unique organ that's different from any other organ in the body. And I think that whole environment makes brain cancer so much more difficult to treat. Delta 24 actually came from our very early studies using gene therapy. In the beginning, when I first started trying to develop therapeutics, what we were doing is using viruses to deliver anti-cancer genes. Delta 24 has really now blossomed into a huge research program and actually has now led into a whole new program that's being supported by the institution, which we're calling the Cancer Neuroscience Program, which is a comprehensive program trying to understand the interaction of the nervous system and cancer, and then as we understand that interaction better, then further develop therapies.
Research can only move as quickly as the resources that it has. With more financial support, researchers like Fred Lang and those in his lab are able to advance research so quickly.
The Broach Foundation has helped us fund a program which we call Catalyst. It's a program that takes every tumor from the operating room, brings it to the lab, and allows us to analyze that. And one of the most important things that's come out of that is the development of tumor models, what we call glioma stem cell lines. These are cultures that come from individual patient tumors. We now have about 150 of those cultures, and we've completely characterized about 50 of them. So the last way they've helped us is by helping us fund some young investigators.
The unique aspect of MD Anderson is that
The research that is being done is a springboard for clinical trial development. It's incredibly expensive to get trials off the ground and get them completed. And so having a philanthropic pipeline and philanthropic support is really essential to completing these trials.
I think, going forward, we're excited to develop further biologic agents, find novel ways to open up the barrier between the blood vessels and the brain tumors, come up with more clinical trials that we can enroll more patients and find new ways to treat brain tumors.
That's where the financial support from the Broach Foundation really is instrumental in terms of building those pillars that allow for all the subsequent research to occur.
It allows me to be the clinician scientist that I'm trying to be.
It's been a really impactful collaboration between the Broach Foundation and MD Anderson.
So we thought it was really important this year that we take some time and go to MD Anderson, meet with the researchers. Dr. Lang's been able to attract an amazing faculty and staff. We get to hear from Dr. Lang usually every year, but we don't get a chance that often to hear from each of them.
This laboratory, as you can see, is quite expansive. This is what we call an open lab design. The collaboration between the different groups. In most places, people end up what we call siloed, right? The neurosurgeons are separate from the neuro-oncologists. All of these different groups are actually here in the same place, working toward a common goal.
Just to see the working space and how collaborative it is and how everybody works together was really exciting. And then to see the advancement in technology. I mean, even in the last couple of years, the equipment that they've been able to procure, that's been able to map these brain cells and the microscopes.
What we have here is a device called the 10X Genomic Xenium. It's the most advanced technology available.
It's really hard to see progress day to day, but you can look over the last 10 years, over the last 12, 13 years, and you can see the amazing progress in the research and the advancements in the technology, but our donors haven't been able to look behind the curtain.
So mesenchymal stem cells are not only used to deliver things, but we're actually studying why they're in brain tumors.
And I think it was really helpful for our donors to see that and to see how their money is being put to work on a day-to-day basis.
The biggest challenge we've had with the clinical trials is funding. Getting enough money to enroll patients in the trials and to treat them, because when you go into a clinical trial, all of the treatments that come along with that, every time a person goes into the hospital, gets an IV, that actually is not covered by insurance because it's part of a clinical trial. And so getting the funding necessary to complete these clinical trials has actually been our biggest obstacle.
When I think about the future for the Broach Foundation, we know there's still so much work to be done in this research space. While so much progress has been made, we could still be years away from finding a cure that works for everybody.
The Broach Foundation has clearly impacted our development of new therapeutics and bringing them to clinical trial. But the Broach Foundation has had a bigger impact on our program.
A big part of our role here at MD Anderson is to educate the next generation of doctors, scientists, surgeons, and that's certainly something I'm very passionate about. Without the foundational support, I think that would not have been possible.
For more than a decade, the Broach Foundation has played an impactful role in the work we do to end cancer at the University of Texas MD Anderson Cancer Center. Your generous support for Dr. Fred Lang and the Lang Laboratories' innovative research has led to incredible strides in understanding and treating brain tumors. Dr. Lang's team has expedited groundbreaking discoveries through clinical trials for next-generation treatments. Now, our world-renowned team is advancing this work through the Cancer Neuroscience Program. This program brings together the expertise of leading neuroscientists and cancer researchers to create a comprehensive understanding of cancer and its linkages to the nervous system, to neurological well-being, and to treatment toxicities. It will drive innovative discoveries and cutting-edge advances to transform the lives of patients worldwide. It takes all of us coming together to make this a reality. Thanks to the Broach Foundation's support over the last 13 years, we are changing the landscape of this deadly disease. On behalf of all of us at MD Anderson, thank you for your continued commitment to making cancer history.
For those of you who believe in the power of research, thank you, Broach Foundation, for turning this belief into a reality.
Funding holds the power to propel cutting-edge technology, infusing hope into the lives of those affected with brain cancer.
With every discovery, we're proving that an investment in science is an investment in humanity. Thank you, Broach Foundation.
I hope that people consider making a donation, not just for me, but for underfunded cancers in general, because there are a lot of them, and I think we can make a big difference.